Johnson has imposed a third national lockdown on England in order to prevent the NHS from being overwhelmed by surging coronavirus infections. People are being told to stay indoors other than for limited exceptions, and these measures are expected to last until mid-February. Boris Johnson spoke from Downing Street.
With most of the country already under extreme measures, it's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant.
Primary and secondary schools are going to be closed to most students, apart from the children of key workers and also vulnerable children as well. Exams this summer are also not going to take place in the usual manner. People who are extremely clinically vulnerable are being told that they should shield again and only leave home for medical appointments and exercise. Boris Johnson says the weeks ahead will be the hardest yet, but he thinks that the country is entering the last phase of the struggle. We saw today, of course, the first vaccinations of people with the Oxford AstraZeneca vaccine outside of a clinical trial. The first person to receive that was an 82-year-old man who received the jab in Oxford earlier today. Of course, that vaccine is one that is potentially much more transportable and much more easily administered to people because it can be stored at less cold temperatures. We've also heard today that there's going to be a national lockdown imposed across Scotland from midnight tonight. Scotland going into lockdown again for the rest of the month, with schools being shut and people being told to stay home. So lockdowns being announced in England and Scotland. Wales has also announced tonight that its schools will be closed for at least the next 2 weeks, and a decision will be made thereafter about what happens then. I'm joined live here on LBC News by Dr. Bharat Pankhania, a senior clinical lecturer at the University of Exeter Medical School. Thanks for your time tonight, Dr. Pankhania. What's your reaction to the measures that Boris Johnson has announced tonight?
Very disappointing, and I'm sure it's very upsetting for many, many people. All these parameters were there. All the warning signs were there. Unfortunately, our Prime Minister found it difficult to say, look, 2020, let us cancel Christmas. Eventually, he cancelled it, or shall we say, shortened it to 1 day. But to be honest, we're always playing catch up, which is such a pity.
How dire is the situation at the moment?
It is very, because I was talking to my colleagues today across the country, and when we have case numbers of 1,000 per 100,000 cases, it's very, very high. And we've got outbreaks in nursing homes, residential homes, hospitals are full, and I know mortality is not that high, but everywhere, all the clinical settings are full and very, very busy with patients.
And what's driving this? We've heard obviously about the new strain of COVID-19. Can all of this be put down to the fact that we have this new strain and it is being transmitted faster?
No, I think that would be incorrect to say blame it on the new variant because it's more infectious. Because you've got to drop your infection control guard to get infected in the first instance. And really the fault lies with we have in the month of December been interacting with fellow human beings in the prelude to Christmas. And when you are doing that in the midst of a more infectious strain, then infections happen. And then once you've seeded the number of infections, it generates more and more. And this is where we are today.
We have heard some comments over recent days of people suggesting that, of course, every winter the NHS faces pressure. Is this year radically different, though?
It is, of course it is, because on the one hand, whilst we haven't got extensive circulation of flu and we've done well with immunizing against the seasonal influenza, our bed occupancy, especially those critical areas, the intensive care units are full, and they're full of patients with coronavirus infections. This is different. This is new.
So obviously Boris Johnson saying that we must stay at home and we must curtail our interaction with others. Is it as simple as that? We just need to follow the rules a lot more stricter than we have been?
Indeed, and I hope this time there will be enforcement and clear, hard-hitting messages that we just cannot carry on with lockdowns. Therefore, you will follow instructions on infection control. It is as simple as that. There is no other rocket science to it. This is a human-to-human spread of infection. Therefore, if you have fewer interactions, you will have fewer infections.
When the epidemic began, I do remember press conferences involving Professor Chris Whitty and Sir Patrick Vallance, and them talking about lockdown fatigue and saying that you didn't want to do things too early because people will get tired of them. Are we perhaps having that visited upon us now, that people are tired of this? They've been doing this for the best part of a year. And that's not mentioning even the Barnard Castle episode, which may also have had an impact on people's adherence to the rules.
I certainly feel that the Barnard Castle episode did make people feel, I'm going to do as I wish. And we will have this fatigue because we've always done it in half measure ways. So we had our first lockdown then late. We came out of it early, then we went into second lockdown, and it was a partial lockdown. And now, finally, I hope that this is a properly enforced lockdown, because otherwise we just can't carry on like this.
Is there, as Boris Johnson says, though, a glimmer of hope, though, regarding the timetable for vaccinations? Boris Johnson mentioned that by mid-February he hopes to have offered a first dose to everyone in the top 4 priority groups. Does that sound like a realistic timetable to you? And does this sound like a route map out of this?
Well, vaccines will definitely be a route map out. Whether by February we have managed to immunize the vulnerable groups, only time will tell, because there are 2 issues here. One, the ready supply of vaccines in large numbers, and second, the ability to inject that into that group of people. The injection bit is easy to do. Getting the large supplies, I hope that also materializes.
Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School. Appreciate your time tonight here on LBC News. So just to reiterate,